I think the number one thing that we're trying to do is gather information across a very fragmented healthcare system, right? And so an example I always give, I think I mentioned it to you for the book as well, but it's very intuition setting, is that when a doctor, or even our doctor, Medicare or not, prescribes you a medication, you'll see them go into their EMR and click and say prescribe medication. But the vast majority of time, unless you pick up that medication literally in the hospital's pharmacy, which most of us don't, right? We'll go to a Walgreens or a CVS. That doctor has no idea whether you ever picked up the medication, right? Just absolutely no idea. Like the pharmacy knows. There's just no system to like talk between those two pieces of software, right? So we as a payer, as a health insurance company, the one thing that's really helpful is that all of this gets charged to the health insurance company. So we can use the fact that we're allocating the dollars as we should to say, oh, Bryan did pick up their med because I see that, you know, there was a claim, there was a charge for that medication. And, you know, we get told what medication it is and when you picked it up and all this good stuff. And we can even say, well, that was a 30-day supply that Bryan picked up in January 1st. And you know what? It's April now and we never saw that get picked up ever again. Right. And so a very simple thing we can do for a doctor is say, when you go back and they see Bryan again, they're like, I prescribed it. Bryan picked it up once, 30 days worth. It's been 90 days and there's only one pickup. Bryan's not taking his meds on a regular basis. Right. That's very hard to do, actually. As a physician, you might even ask Bryan, like, hey, are you taking your meds? And I'll just say that almost certainly you will say yes. Of course I am, doctor. Of course I am, right? Most of the time, people don't say, no, I'm not, and I don't want to, right? But for us in Clover Assistant, we can say, hey, we're not trying to do it. What we're telling you is Bryan only picked up one 30-day supply. It might be something where it might be a socioeconomic issue where the meds are unaffordable. It might be a convenience issue. Maybe you're working 2 jobs and you can't pick up. You don't have time to pick up your medication. You might have forgotten. You might have gotten embarrassing side effects and you don't want to tell anybody that
you're not passing judgment.
That's right. We're not passing judgment. We're just letting the doctor know. And then the doctor is trained to have that conversation, if that makes sense. They're like, let me sort of have that convo. I'm Andrew Toy from Clover Health, and this is the future of insurance.